Hello everyone, welcome to the CTV News on Calabash TV and on the Wave Radio 94.5. I am Lisa Joseph. Well, the main healthcare facility has once again come under heavy public criticism. Victoria Hospital has dismissed as completely false claims that the institution is turning away patients who have failed to make a deposit or clear their existing medical bills. On the weekend, social media was abuzz following a posting that suggested that patients were being denied care because they were unable to pay. The hospital's executive director, Jeanette Hughes, has refuted the allegation, indicating that once members of the public approach the healthcare institution, Victoria Hospital will deliver.
So when someone comes to Victoria Hospital to access the care, that person would be asked to present either their medical exemption card, their insurance form, or they're asked to pay out of pocket. It means, therefore, that someone who is not able to pay and that person has been exempted by the state, that person would be given care and would not have to pay. The person would not be asked to pay anything because that person would be exempted. Persons who have their insurance, the medical insurance, would be required to present their documents, their insurance documents. However, there may be persons who do not have medical insurance and may require to pay out of pocket. And this is what we've done. Our policy as it pertains to payment has not changed. We sit with everyone. As a matter of fact, we've actually established a business office where we give persons financial counseling on how to meet their medical bills, because we do not turn you down. We have had instances where persons have brought in their goods for sale, and we would buy their produce to offset their bills. We've had instances where persons are unemployed, and we have a need for temporary employment, and we would actually employ persons on a temporary basis, and they would contribute towards their bill. So Victoria Hospital is definitely about giving service and to work with the clients we serve. We do not turn, and I will categorically deny this, we do not turn anyone at Victoria Hospital because they're not able to pay.
Ms. Hughes has appealed to anyone who may have had the experience of being turned away to contact her directly at victoria.hospital@govt.lc or her telephone number, that is 456-8201. They can also make an appointment with her secretary to have a private meeting with her. Now, the claims against Victoria Hospital bring to the fore a larger issue that the government has been grappling with, that of healthcare financing, as it looks to introducing universal healthcare. We'll hear from the politicians in a moment. First, St. Lucia has secured assistance from the European Union in undertaking a consultancy on health financing. In the last 6 to 9 months, consultant on the project, John Armstrong, has been preparing a model. He recently presented that model to the Ministry of Health.
We've been looking at a number of elements. The first element really is the demographic profile of St. Lucia. What will the projected population be in the next 5 to 10 years? We've looked at birth rates, death rates and migration patterns, and that's important ingredients into understanding what are the needs of the St. Lucian population for healthcare. So that's the first bit. We've also tried to understand the prevalence of particular illnesses and the likely cost burden the population will have in the future for particular illnesses under any universal healthcare package.
And the Chief Health Planner, Zyster Edmond, says the aim of the Universal Health Coverage Project is to ensure access to all at an affordable price. However, there are huge challenges in making that a reality. The Health Ministry is approaching the issue with a financing policy and a separate strategy.
The health financing strategy in particular is that strategy that's going to identify or link the capacity of the economy, the financing options to providing the package of services. We have identified the package of services, but now in order to make it feasible, in order to make it sustainable, we have to determine how do we pay for this and what is the potential in the economy to pay for it and what are the other strategies that are out there that can help support and sustain this strategy. The second component is the policy. We need to be very clear as to how health financing is going to be executed, what is the role and function of every agency in this process. So the financing policy is going to speak to the steps, the procedures, and the options that will support the changes in legislation in order to ensure that this becomes a reality.
Also enlisted in devising the best possible model is the HU Center of Health Economics at the University of the West Indies. The research institute has been providing direction to a number of Caribbean islands for years now. Director Carl Theodore says a workable approach is keeping financing costs low. This, he pointed out, will be to the benefit of all involved.
The health system itself has to be strengthened so that the things we do have to be done in a way that keeps our costs as low as possible, the things that we do in the system. But the second aspect of it is that if you really want to keep your costs down, what you have to do in the health system is to keep the demand for health services down. In other words, you don't want the numbers of people that are coming for care, that number has to be controlled. And when you think of areas like hypertension and diabetes, for example, these are lifestyle diseases as we call them. And it means then that part of what we're doing has to have a significant primary care emphasis, because one of the first dimensions of primary care is really prevention. Right? And we have to try and make sure that the numbers of people falling into diabetes, and that those numbers have to get smaller, because if they keep growing as they're growing, we certainly will not be able to provide care for everybody. So, and one of the good things I know is that the Ministry of Health now is conscious of that, and they are putting things in place to ensure that the efficiency of the system is improved, but also that the prevention side of the system gets more focused.